Vaginal Leptothrix is a pathogen or commensal, a morphological study in pap smear.
So first of all, what is Leptothrix? Leptothrix is a commensal organism, non-pathogenic thread-like bacteria. It is also classified as one of the endogenous normal flora in the vagina. The name itself is Leptothrixia buccalis, which previously referred as Leptothrix vaginalis. It can be found in the oral cavity, intestine, vagina, and uterus of the pregnant women. The significance of Leptothrix is that it is commonly found with Trichomonas vaginalis, Candida infection, and bacterial vaginosis. However, there is also some study that report Leptothrix can be found alone or with Dodilin bacilli. Moreover, about half of the patients are oral contraceptive users. We move on to the presence of Leptothrix is because premenopausal women were more likely to experience the Leptothrix than postmenopausal women. However, there is currently a dearth of research on this topic. Hence, the specific identity and origin of Leptothrix is still remain unclear. Molecular methods now being employed to research the vaginal microbiome could shed further light on the function of Leptothrix. Furthermore, correlation between microscopic result, symptoms, and molecular diagnosis are required.
Next is morphology of Leptothrix. Leptothrix are non-pathogenic, filamentous, gram-positive, non-spore-forming anaerobic organisms. It is long, thin, segmented, filamentous structures with occasional branching. It also may form loops and more frequently in conventional smears because in liquid-based cytology, the background virtually eliminated, so Leptothrix is hardly to be seen. Other than that, Leptothrix also sometimes exists in pair. These organisms also tend to form clumps in liquid-based cytology preparations, as opposed to conventional smears. It is frequently noticed with coexistent Trichomonas vaginalis infections, but rarely observed with Lactobacillus infection. Trichomonas and Leptothrix together have been referred to as spaghetti and meatballs. Most of the cases, Leptothrixia and Trichomonas were observed together in 95% of cases in a study of 1,000 cases. Next, why Leptothrix associated with bacterial vaginosis? Bacterial vaginosis is characterized by a transition from a vaginal flora dominated by lactobacilli to one dominated anaerobic pathogens. Leptothrix is an anaerobic bacteria, so because of that, it may be present in bacterial vaginosis. Now let's see why Leptothrix is associated with Trichomonas vaginalis. The contamination can lead to presence of Leptothrix along with Trichomonas vaginalis, or TV, which is the actual pathogen. The morphology referred as spaghetti and meatball. Sometimes it's quite confusing to differentiate between Flagella TV and Leptothrix. So how to differentiate them? For Flagella trichomonas, it has 4 to 5 flagella to the membrane of Trichomonas vaginalis. Meanwhile, for Leptothrix, usually present in the background. Leptothrix can be associated with TV because they live in the same environment, which is moist environment and pH more than 4.5. This may increase the likelihood of them being present together in the pap smear.
Next, we go to difference of morphology of pseudohyphae and Leptothrix.
Next, differences between Lactobacilli and Leptothrix. Why we need to differentiate between Lactobacilli and Leptothrix? It is because the characteristics and the morphology are quite same. First, Lactobacilli. Genus for Lactobacilli is Lactobacilli acidophilus. Length for Lactobacilli is range from 2 to 9 micron. It has long tip or thin filament singly. The overgrowth of Lactobacilli is not necessarily psychological, and excessive of lactobacterial cytolysis can cause symptoms and signs of vaginosis. Next, Leptothrix. Genus for Leptothrix is Fusobacterium. Length for a Leptothrix is range from 45 to 70 micron. Leptothrix is non-pathogenic, treat like bacteria, much longer, thinner, and darker than Lactobacilli, and it lies in loop or hairball or a plate of spaghetti. The presence of Leptothrix in a smear is no clinical important except symptom of Leptothrix: burning during urination, vaginal itching, pain, thick and yellowish vaginal discharge, dysuria, and dryness. Next, treatment. Treatment is necessary because the symptom caused by Trichomonas vaginalis makes the patient feel uncomfortable. As a result, the antibiotic prescribed is specifically made for this organism. The pathology recommended that use metronidazole 500 mg orally 2 times a day for 7 days. For patients who have metronidazole resistant, we can use alternative way that we can give tinidazole 2 grams orally in a single dose. Metronidazole gel is not recommended as it does reach therapeutic level and it less effective than oral metronidazole.
For treatment, the treatment must be considered based on the patient's symptoms. For Leptothrix, it's recommended monitoring the condition to see if it goes away on its own. Second, in some cases, antibiotic may be prescribed to help clear the bacteria. Treatments for Leptothrix consist of 500 mg of amoxicillin clavulanate to be given orally every 8 hours for 7 days. For summary, Leptothrix is Commensal and as marker if there is any